Okay, today we're going to talk about fever. I'll preface that we are actually in the hospital with a fever, so this seems extra relevant. At some point I'll probably re-record this from a slightly more professional location, but today we're in the hospital, just keeping it real and keeping going on our 30-day challenge. So the fever in sickle cell means a lot more and should be treated a lot more seriously than a fever you or I get. So in a typical family setting, if your child gets a fever, you give them something similar to Tylenol or Motrin and just kind of wait and see if the fever goes down. However, in sickle cell, that is extremely dangerous. One of the only symptoms of something called a blood infection is a fairly low-grade fever around 101, and a lot of times there isn't any other symptom. So Sophia has actually had a blood infection which can be fatal if not taken care of quickly, and her only symptom was a fever of 101. So in sickle cell, anytime you get a fever of 101 or higher, you are required to go to the clinic if they're open, which, you know, most people don't seem to get fevers from 8 to 5 Monday through Friday, or to the ER so that they can run labs and draw what's called cultures. So what cultures are is they take some of your blood and they put it in these funky looking tubes and they send it down to the microbiology section and they let things grow. And if you have a bacterial infection, typically within 24 to 48 hours, something will grow in that bottle, and then they can decide which type of IV antibiotic to give you. However, if it's a virus, then there's typically not anything they can give you, and they just have to kind of monitor your hemoglobin rates, your pain, if you have any, and your reticulocyte count to make sure that, and your white blood cell count to make sure that you're fighting things off. So today's post, I will keep it short since we are in the hospital. I did want to stay true to my word and post something, but fever and sickle cell, not something to medicate, something to immediately call the hematologist and your doctor about, and to get in to the ER or clinic, depending on what time of day it is, and get seen. Check us out on the web at hopeforstd.org. Leave any comments or questions below, and stay tuned as we continue our journey through complications. Thanks.